All right. Hi, everyone. I'm Stacy, a community and engagement coordinator with the Mental Health Society. Today, we're joined with Amy Pinnell, a counselor. Welcome, Amy. Thank you for joining us today.
Hi, yeah, I'm so happy to be here. Thanks for inviting me, Stacy.
So can you tell us a little bit about yourself and your background?
Sure. So I am a registered social worker. I did my master's of social work at the University of Victoria, and I'm currently working as a private counselor here in Victoria, and yeah, doing some online sessions, but also some in person. And in terms of my background, yeah, during my master's, I worked with the Kool-Aid Society and with AIDS Vancouver Island, so primarily with the homeless population. And then I spent about 5, 6 years working with Island Health and various mental health and substance use programs. Most recently, I worked with their addiction outpatient treatment clinic, and in that role, I was a substance use counselor. And so my private practice, I really just started it in July. So it's been an exciting transition. And yeah, that's a little bit about me.
Sounds like you've got a very intense background, like a lot of experience in this area. So this
Yeah,
is
I would say so. Yeah, lots
yeah.
of varied experience. And yeah, and I think that really has shaped my private practice. So it's been exciting to just kind of, yeah, work in these different roles.
That's great. And if in your private practice, so what kind of services do you provide, and are they targeted toward a certain demographic?
Sure. Yeah. So right now I'm just offering one-on-one counseling, one-on-one therapy. So down the road, I hope to offer some, maybe online groups or programs, but right now it's just the one-on-one sessions. And I work just with adults. Um, but in terms of demographic, I work with all ages, genders, sexual orientations, and all races. And I have a wide experience of, working with people with lots of different mental health issues or concerns. So yeah, it's pretty broad in that way, but I do specialize in working with folks with anxiety, with substance use addiction, and with codependency. And I have a special interest and some experience working with folks who've experienced trauma. And yeah, so I do have a lot of insight around that, and I'm also working on getting some additional training around somatic experiencing to better be able to support those folks with trauma.
Wow, that's great. Um, what would you suggest to somebody who's either new to counseling, has never done it before? What advice can you get them, maybe first steps or what the experience is like?
Hmm. Absolutely. Well, I mean, first off, like, I think it's great that you're, wanting to get some counseling. You've got to that point. But yeah, it is an overwhelming process. Like, I think it can be really hard to know where to start. And I would say that um, I think it depends kind of your situation and your perhaps primarily financial situation where you're going to start that process. I would say if, you're not able to afford a private counselor, then a good place to start would even just be talking to your family doctor, because they'll have the resources to refer you to a whole bunch of different programs within Island Health. Well, they'll be able to refer you to the Island Health mental health and substance use intake, and from there you can get an interview and they are able to direct you to all their different services and figure out what's a good match, or also some community services. And I know that there's already some interviews on your Instagram that, with a Squibble Neighborhood House and some other programs that offer free or low cost counseling. And if you're looking for private counseling, a good place to start there is if you have any benefits with your employer, you can check to see what designations that they cover. And that'll give you a sense of where to start, because some will cover psychologists, clinical counselors, or registered social workers, which is what I am. And from there, you can, search. There's, I mean, a great directory would be Psychology Today. They have, all different designations on there. You can search by, what area you're looking for, what gender, all different things, and you can read their profiles, get a sense of who they are. And I would definitely encourage you to do, even just, if you can narrow down to a couple folks that, you resonated with, to do a phone or video consult and get to know them just a little bit, see how it feels to talk with them. Does it feel safe? Does it feel comfortable? And then go from there, knowing that, you don't have to commit to working with them to start
Yeah,
out. It is, there is a lot of anxiety when you first start counseling. But yeah, getting to know them and just knowing that, it is you can always, end that relationship, or seek out someone who's maybe a better fit for you. And I think being patient with yourself during the process, and knowing there are lots of resources and lots of supports out there. But it can take a little bit of time to just find the right one for you.
for sure. I definitely like the point that you brought up of contacting them first and doing like a little
Mm.
consultation to make sure
Mhm.
you know that that person's going to be right for you.
Yeah,
'Cause-
exactly. Yeah. And I think that's a good time you can check, like, yeah, also even just like schedules and fees and things like that. But yeah, how does it feel to talk to them? Yeah,
yeah, because it's hard to open up to somebody new.
absolutely.
Yeah, I definitely, that's a great point to bring up. And what kind of advice would you offer to, let's say, a family, you're looking after a family member or a friend and you see that they're struggling? How can you support them or reach out to them?
Hmm. Yeah. So if you're, if someone, in your personal life, your friends or family are struggling with any type of mental health issue, I would just recommend to just be as kind and empathetic as you can. You're not going to be able to fix anything, or to, prevent them from struggling, or like prevent that pain that they're going through. But just being there, just letting them know they're not alone and they have support, makes a huge difference. Like, I think just, yeah, it can be really isolating
Sure.
when you're going through mental health struggles. So really just letting them know that they're not alone, and that, offering some kindness. And I'd also recommend that if you're someone who's trying to support somebody else, that you maybe get some support yourself. We can get kind of lost taking care of others sometimes. So it is important that you take care of your own needs, give yourself some self-care, maybe even get some counseling support yourself, because yeah, you're worth it too. And and just know that, it's, just doing the best you can. I'd say giving yourself some self-compassion around what you're able to offer in your capacity.
Yeah, for sure. Definitely agree with you there. And brought up the self-care. What kind of mechanisms or coping strategies do you suggest, or have people told you that they've done that they do,
Hmm. Hmm. Yeah. So in terms of self-care, I mean, I think that it's really personal. So I mean, I recommend, finding what feels good, what feels comforting, what feels soothing. Sometimes we can see self-care as like something else we need to achieve, or like a box to check off, but it's really about just tuning in, like taking a moment to pause and ask yourself, like, okay, what do I need right now? Like, how can I care for myself in this moment? And that can look, yeah, like different for different people, but not just different people, but in each moment, right? It's going to look a little bit different. And, sometimes that's going to mean like getting up and moving and getting outside. And other times it might actually mean like, oh yeah, I'm just going to watch TV for a little bit. I'm going to stop doing and just let myself be. Yeah. And I think in terms of coping strategies, ones that that's, simple, I guess, and recommend a lot, is just breathing. So you can do like belly breaths, where you're breathing really deep into the belly, and when you exhale, you feel the belly contract. Or box breathing, where you count your breath, like you count to 4 on the inhale and 4 on the exhale, and kind of create this rhythm with your breath. Because when we're breathing just into our chest, when our breath is really shallow, it signals distress to our nervous system. And when we breathe nice and deep into our belly, it lets our nervous system know like we're safe and it's okay to relax and settle. So that's something that's really simple that you can do anytime you're activated or feeling distress. It's just, it's physically, or it's letting our body know like, no, it is okay in this moment. And in addition to that, like any type of I guess grounding where we're staying in the present moment, right? If we're noticing our thoughts are really in the past or in the future, just engaging all of our senses, like noticing what we can smell and see and feel, and bringing maybe some textures that are comforting to us, some tastes that are comforting to us, soothing music, engaging all the senses so that we can help ourselves stay in the present moment. It can be self-care if it's those comforting things, but it can also be a coping strategy if our mind is really busy and we kind of want to come back to this moment.
Yeah, there's some great points there. Some of those things like you don't even think of when you're thinking of self-care is, like you said, you're just sit down in front of the TV and just let your mind go, or,
Mm-hmm.
grabbing that cozy blanket, then just being able to touch it, like that's part of it too.
Absolutely.
Yeah.
Yeah. Yeah. Mm-hmm.
Well, that's great. Is there anything else that you want to add to this, Amy?
Well, I think I would just like to say that I know right now, this time of year is really hard for people, January, February, here in Victoria, it's very gloomy. Other places, there's lots of snow and it's really cold and not a lot of sunlight. So it can bring on, some low mood, the winter blues. And then, of course, this year it's amplified with the pandemic. So I just want to acknowledge that if you're struggling right now, that it is okay. It's pretty common, and just to be really kind and gentle with yourself, to know that it will pass and that things will improve and that help is available. And yeah, to just take really good care and be kind to yourself through the process.
That's nice. And how can people get a hold of you?
Sure. So yeah, I'm on Instagram, so at Brave Spirit Counseling, and also my website, www.bravespirit.ca. I have a contact form on there if you want to reach out.
That's great. Thanks so much, Amy.
Thanks, Stacy.